in Yolo County in the midst of the current pandemic. My name is Jessica Hubbard, and I'm the Executive Director of the Yolo Community Foundation. Quick bit of housekeeping up front. I'm sure we all have a number of questions for our fantastic panelists. Our moderator will open the discussion for questions from the audience later in our panel. So please go ahead and use the chat box to ask your questions. You can save them till towards the end, or you can enter them as they come up. Today's panel is the third in a 5-part series that will take place between now and the end of March. So far, we've covered food insecurity, as well as child and family needs. And our upcoming topics include housing insecurity, as well as a look at where we go from here. This series was born out of a State of the Yolo nonprofit sector update that we developed in November. And that update was based on a survey of about 40 local nonprofits, as well as close to a dozen interviews with local nonprofit executives. While there is, of course, a very wide range of critical community needs and many community groups that are deeply impacted, the topics that we're addressing in this series are those that came up over and over again in our research, as well as throughout our work in the past year. Our goal for this series is to help the community thoroughly understand what our local community needs, how local nonprofits address those needs, and the critical role that local donors, volunteers, and other decision makers play in supporting those efforts. So our hope is that this will enable us to come together as a community to serve our neighbors in need throughout the current crisis. I'd like to take a moment to share a huge thank you to our sponsor, Sutter Health. Without support from Sutter Health, we wouldn't be able to put on this event series. Sutter, of course, is deeply involved in the response to this pandemic as a local healthcare organization, and in addition is a major supporter of local nonprofits and a real pillar of our community. We're particularly thrilled today to have a Sutter practitioner on our panel. I'd like to share the following brief statement from Sutter Health in their own words. As a not-for-profit organization, Sutter Health reinvests in the communities we serve through community benefit programs that address priority health needs for underserved and vulnerable populations. Community is at the heart of who we are and what we do. Our work goes beyond traditional healthcare, and we extend support outside the walls of hospitals and care centers, which helps improve the health of the overall community. We're thrilled to sponsor the Yolo Community Foundation's COVID-19 Community Needs Series and take part in these important discussions. We look forward to hearing from all the wonderful panelists, many of whom are collaborative partners of ours, and sharing the valuable information learned throughout the series with our organizations. And we're thrilled to Sutter Health to have that partnership. We at the Yolo Community Foundation are also feel very honored for the opportunity to host this panel series. For those of you that aren't familiar with YCF, our mission is to inspire and support giving and to provide philanthropic leadership in Yolo County. We are founded in 2001, and today we have about $7 million in assets spread across 65 individual funds, and we made about $1.5 million in grants in 2020. We're an affiliate of the Sacramento Region Community Foundation. Our efforts fall primarily into 3 pillars. First of all, we work to inspire giving locally. We do that by offering philanthropic funds like donor advised funds and nonprofit endowments that make giving easier, tax advantage, and more effective, and therefore encourage more giving. We also work to promote philanthropy through events, media, and other outreach, including activities like our panel today. We work to support philanthropists locally, our fund holders, as well as other philanthropists in the community through one-on-one staff support, as well as events like site visits, small group discussions, and expert panels like the one we're about to hear. Our goal through supporting philanthropists is to provide local donors with the education to be effective in their giving, the inspiration to be excited about giving, and a sense of connection to a community of peers that's working together to serve Yolo County. We also serve local nonprofits directly by growing giving as fund holders through our nonprofit agency funds, through our grant making initiatives like the Yolo COVID-19 Relief Fund and our Buck Education Grant, and professional development programs, primarily through the Yolo Nonprofit Leaders Alliance Partnership. A key part of what we do is offer these several types of philanthropic vehicles, the funds that I've alluded to. Think like a financial vehicle along the lines of a checking account or even a 401k, but designed for your philanthropy. These funds can simplify your giving, they can make your giving more effective, and they can have significant tax advantages. Fund holders can also access foundation staff support and join a community of peers working together to make an impact. Our most common fund type is a donor advised fund, which is a lot like a private foundation, except with a much lower minimum fund size since you're becoming part of a coalition of funds working together. So if you're interested in learning more about how to collaborate with the Yolo Community Foundation, whether as a nonprofit, a volunteer, a fund holder, or otherwise, Please don't hesitate to contact me. My email is jessica.hubbard@yolocf.org, and I'll drop that into the chat momentarily. Now, I'm thrilled to introduce our moderator today, Petrea Marchand. Petrea founded Concero Solutions, which is a consulting firm in Davis, to help local agencies and nonprofits deliver public policy priorities to benefit communities as well as the environment. Over the past decade, she has secured over $20 million in grants for local projects and programs, as well as completed multi-year plans to guide policy initiatives, implemented public outreach programs, developed strategic plans, and developed agency budgets. She is also a founding member of the Save Pine Tree Gardens Committee, which is a citizens committee which successfully helped save 2 Davis homes for adults living with mental illness, and is also the treasurer of the Yolo County chapter of the National Alliance on Mental Illness. Petrea has a master's degree in public policy and a master's degree in environmental management from Duke, as well as a bachelor's from Pomona College. I had the honor of working closely with Petrea last spring when she was deeply instrumental in helping us launch the Yolo COVID-19 Relief Fund. So I'm thrilled to have the chance to work with her again today. Petrea, thank you so much for moderating. I'll turn it over to you.
Thank you so much, Jessica. And thank you to the Yolo Community Foundation for selecting mental health as one of the topics for your COVID-19 community series. We're here today with a wonderful panel of experts to highlight local mental health needs, including changes that are needed, changes in needs as a result of the COVID-19 pandemic. We're also here to help community leaders understand these needs because they're complicated and involve a lot of different organizations. We also are here to identify opportunities for our communities to work together and to understand the work that local organizations are already doing in this space. As a member of the board of directors for NAMI Yolo County, I know firsthand how many organizations, many of you are here today, I can see from all your names in the chat, thank you so much for participating, are providing many innovative and important services. But I also know, based on my experience as a board member, that there are many new ideas to explore and partnerships to build. And I'm looking forward to today's conversation and hope that we will further that, that discussion. Before I introduce the panelists, I wanted to make a very important distinction between 2 general categories of mental health conditions in our community. The first is serious mental illness as defined in the Diagnostic and Statistical Manual of Mental Disorders, such as bipolar disorder or schizophrenia. And the second is situational mental health conditions caused by life events, such as death, a death in the family, or the impacts of the COVID-19 pandemic, which now has taken the need for improved mental health services to a whole nother level. This distinction is important because the treatment of individuals living with serious mental illness is often chronic and requires not only medication, but permanent supportive housing and other significant government resources. And by that, I mean, in some cases, 24/7 care. Treatment for situational mental health conditions may be limited in duration and may consist of medication, therapy, meditation and mindfulness training, and other services provided through insurance, nonprofit, government, and private practitioners. It's also very serious, but often requires different types of treatment and services. People living with serious mental illness and situational mental health conditions in our community needed additional services prior to COVID-19. And all of you here know, with all of the work that you're doing in your own nonprofits and organizations, or as individuals and family members supporting people living with mental illness, you know that the need now is more urgent than ever, especially given the significant trauma experienced by many people as a result of the COVID-19 pandemic. It's also important to remember, and we're going to touch on this today during our conversation, that the mental health needs are different for different populations within our community. We know, for example, that Black, Latinx, Native American, and Pacific Islander populations have been more significantly impacted than by the COVID-19 pandemic than other populations. According to Dr. Ton at the Center for Reducing Health Disparities at UC Davis, compared to whites, and this is an amazing statistic, Black, Indigenous, and people of color are 25 to 50% less likely to initiate mental health treatment, 40 to 60% less likely to fill their prescriptions, and 40 to 80% more likely to end their treatment prematurely. Seniors during the pandemic have been isolated from their families and friends and suffering increasing levels of depression. Youth who have engaged in remote learning for over a year are experiencing high rates of anxiety and other mental health conditions at an unprecedented rate. So we know that we have a lot to discuss today, but also a lot of amazing people, both here in the public and on our panel. And so hopefully we will leave this panel today with the ways different organizations and individuals who support people with living with mental health conditions can work together to address these needs. The panelists will be answering questions related to this topic for the next 45 minutes, after which we welcome questions from the audience. You'll be prompted, as Jessica said, to put those questions in the chat. All of you participating today are an integral part of the work to identify opportunities to improve mental health service. Every single one of you, we need all of you. So please don't hold back. We want to hear from you today. So with that, it's my pleasure to introduce our panelists. First is Dr. Irmi Patel, who is the Director of Clinical Care for Sutter Health's Mental Health Services line. She has an extensive background in community mental health, both in the public and private sector, providing clinical service, administrative and managerial oversight, and program and policy development. Dr. Patel has a master in marriage and family therapy and a master and a doctorate in clinical psychology from the California School of Professional Psychology in Los Angeles. She has over 18 years of clinical and supervisory experience. We are so lucky to have her in our community. Prior to joining Sutter in 2017, she served as the consulting psychologist for the state of California's Mental Health Oversight and Accountability Commission, which, as many of you may or may not know, manages all of the money from Prop 63 for mental health services. It's an enormous and important funding source for the work that we do in Yolo County. And she also was the program manager for the County of Los Angeles Department of Mental Health. So she's been right there in the trenches with everyone who's working on these tough issues. At the Department of Mental Health, she implemented prevention and early intervention evidence-based practices within community mental health and forensic mental health settings for adults receiving county mental health services. So welcome to Dr. Patel. Our next panelist is Diane Summers. She is the Executive Director of Suicide Prevention of Yolo County. She has been the Executive Director for over 30 years, working in all areas of crisis training and intervention. Founded in 1966, Suicide Prevention of Yolo County is one of the oldest crisis lines in the nation and operates 24 hours a day, 365 days a year. We are so lucky to have this resource in our community. The agency also serves teens, so we're looking about hearing more about the services provided to youth today, and provides support groups to loved ones, to people who have lost a loved one to suicide. Ms. Summers also, and those who work at Suicide Prevention of Yolo County have been especially needed during the COVID-19 pandemic, since the number of calls to their crisis line has more than doubled. Our final panelist is Dr. Zendejas, who is the Executive Director of RISE Incorporated. Tico Zendejas RISE is a nonprofit organization providing a variety of social services to the communities in Western Rural County. Mr. Zendejas has been involved in youth development and social services for over 2 decades. He is a strong advocate for youth development, education, and equity. RISE partners, and this is an amazing story, with other organizations and professionals to bring mental health services to rural communities. When the local nonprofit mental health services agency closed their doors, RISE rose to the challenge, and they created their own mental health care system within the rural community. Dr. Zendejas is also, as if what he's doing at RISE isn't enough, serving his second term as a member of the Woodland Joint Unified School District Board of Trustees, and serves on the Yolo County Office of Education Board of Trustees. So he's also going to bring educational experience as well as the rural community experience to this panel. So thank you, all of you, for being with us today. And I'm going to start off with Dr. Patel. I'd like each of you to just very quickly share a brief overview of your organization and what you do to address mental health in Yolo County.
Hi, I'm trying to think. Good morning, I think still. So thank you so much for the opportunity to be a part of this panel with my esteemed colleagues on the panel as well. So Sutter Health is a not-for-profit integrated healthcare system in over 20 counties in Northern California, including Yolo County. We have definitely taken enormous strides in the last 4 years to really figure out a way to streamline our mental health services and improve access to care for our over 3.5 million patients and over 50,000 employees. Our focus, as I mentioned, has been primarily on being innovative to figure out how to get access to care, knowing full well that there is a limitation of brick and mortar locations as it relates to mental health services. Trying to determine what are the best practices we want to bring forward, identifying evidence-based practices that we know are impactful and successful with helping individuals who are living with mental health issues. And then, of course, focusing on workplace mental health. As you all know, especially in this last year, we've had a huge impact on our frontline healthcare workers. And as a system, we're really trying to make sure that if we don't take care of our physicians and our employees, that's going to impact the care for our patients. And so we make sure that we're focusing on their workplace mental health issues as well.
Thank you, Dr. Patel. Ms. Summers?
Better unmute here. Thank you. I appreciate the introduction. And all I really would like to add is that, yes, it is true. We have been operating for over 55 years in Yolo County. We, in 2019, we actually started working with the state of California with the CalMESA Mental Health Services Act program. And we now also operate the North Valley Suicide Prevention Hotline. So we operate that for over 14 counties, Monday through Friday from 9 a.m. to 7 p.m. at night. So that is something that we just recently added in the last couple of years. We're also a member of the California Suicide Prevention Network, as well as being accredited with the American Association of Suicidology and accreditation with the Lifeline National Network. So I just wanted to add that part to what we've been doing. Thank you.
Thank you so much, Ms. Summers. Dr. Zadejas?
Yes, good morning, everyone. Thank you, Petrea, and special thanks to the Yolo Community Foundation and to Sutter Health for convening this forum. This is a key time for us to come together and collaborate and share information that's going on in our county, important issues. So thank you very much for this opportunity. So RISE, we partner with organizations because we serve the rural part of our county, so west of the 505 freeway, Madison, Esparto, Capay Valley, and the city of Winters. And we also provide youth employment in the city of Woodland. But primarily we're focused on in the rural areas. And we're all about partnerships. And so for many years, we partnered with the Yolo Family Service Agency, who were the mental health providers for Yolo County for over 6 decades. And unfortunately, they had to close their doors a few years ago. And one of their clinicians, Patty Jaime, who was working for YFSA, approached RISE and asked if she can start a mental health program out in the rural area with RISE. So 3 years ago, we brought on Patty as our mental health director and partnered with the county HHSA, with our local school districts, with the Yochidi Wintu Nation to focus on mental health access, direct access for our young people, for our students in the K-12 community. So that's what we focus on currently. We had a great partnership, well, we have a great partnership with our local school district and the Yochidi Wintu Nation. So we're very fortunate in Esparto to have a mental health clinician at each of our school sites. And we're going on our 2nd year, and we can see the difference. We can see the impact in getting our young people direct access when they need it, to be able to work with parents and families immediately. Access and equity out in the rural community has been a challenge, and we've been very fortunate with our partnerships and the commitment to serve our families to be able to start this innovative program. And as I mentioned, we're in our 2nd year, and this last year has been the COVID year, which has been very challenging, and I'm glad that we're having these conversations. But we're looking forward to the future and strengthening that partnership and continuing to have a clinician that is on the school campus, that is integrated into that culture. And we're really focusing on building relationships with our young people and family to reduce stigma. Right, we focus on mental wellness. Right, how can we keep young people and the family well? How can we get them connected to the services that they need? And so RISE is a partner. We're happy to be here, and I'm looking forward to this dialogue.
Thank you so much. So on this first question, we're going to really dive in and just talk about what the needs are in our community. The top mental health needs. So if you could list 2 to 3 of the top mental health needs from your perspective, and again, Dr. Patel, I'm going to start with you. For each of the 2 categories of needs, it's really going to be important today. I know from seeing all the different people who are participating that we break up our recommendations and our discussion into needs for people who are living with serious and persistent mental illness and those that are living with situational mental health conditions. So Dr. Patel, from your perspective, what are the top mental health needs in our community?
Sure. So I'll start with the SPMI patient population. I think Yolo County actually led the initiatives when it came out with the Project Room Key project that came out during COVID as a representation of what is oftentimes a very fundamental basic need of this particular individual who's living with SPMI, and that's housing. Oftentimes, because of their mental health condition, they're not able to sustain employment or school that allows them to then have the means to cover their housing. And so I think that project really sort of led the way of what is a great idea in terms of providing that current/permanent housing for this individual. I think an additional step to that, though, could be providing that wraparound supportive services. So, for example, if somebody does live with mental health issues and they're living in a permanent housing situation, how can we support them with transportation to get to their medication appointments or to get case management or even therapy, even if it is on site, just to allow them the opportunity to address those barriers that are preventing them from being able to live daily in a way that sustains their housing situation. I think another example that has come out with Yolo County, which I think is a representation of things we should look to, is an incident that happened in Davis where a young man who was living with a mental health condition and he had a crisis had received a response from law enforcement. And I think there's an opportunity for us to support our first responders and our law enforcement team members with either their own skills and tools or pair them up with, let's say, a social worker that has the means to be able to use crisis interventions to de-escalate the situation in the hopes of preventing any harm to the individual or to the first responders or law enforcement. Stepping away from the SPMI patient population in terms of somebody else who might just need that immediate help because of a situation like a trauma, I think the biggest thing that we have an opportunity to do is determining what's the best level of care. I don't necessarily think always we have to send somebody straight to therapy or send them straight to medication management, aka a psychiatrist. Sometimes there's other things that are available for individuals who have more temporary things that are happening in their life, and they need to just do that check and adjust. And how do we figure out what those resources are? And more importantly, figure out that very streamlined process and pathway to access those cares. So I think that would be something that we could definitely do for those individuals.
Thank you, Dr. Patel. Dr. Zadejas?
Yes, thank you. Piggyback off of Dr. Patel, that's what the RISE focuses on the lower to moderate mental health services, and we're big on the prevention. So working with our families and our young people and the prevention piece. So we've done Prop 63, the Mental Health Services Act, to provide those evidence-based prevention and early intervention programs for our young people in the K-12 of Esparto and Winters. And that's the absolutely key piece, is to get these young people early, to get them involved in evidence-based programs and build that socialization and resiliency in our young people. So what we're seeing in the rural area, some key challenges are access and outreach and education. So the outreach and education, particularly in the rural community, and we do have a large dominant Latino population and a lot of agricultural farm workers. And a key thing is that relationship building and trust. And that takes time to establish, to build that relationship and trust, to reduce stigma so that individuals are more willing to access services that they may need in the future, or be able to recommend and refer other family members that might need those services. So prior to COVID, we're big on boots on the ground, going where the individuals are, particularly in the rural community. So going to farm sites, going to employment sites, going to faith-based organizations, and being involved in the community has been a key aspect of our outreach. And even in the COVID area, there's still things that we can do in this environment to do effective outreach. However, it has been a big challenge to not be able to be on the work sites. It has been a challenge. And the access piece, I want to lead with or leave with just a very positive note that for many years, for decades, our community has been focusing on bringing a health clinic to Esparto. And very recently, words can't express our gratitude and thankfulness to the Yochidi Wintu Nation, who granted a large grant for a brick and mortar facility. So we're partnering with the Winters Healthcare Foundation. They're going to be the provider of a medical center in Esparto. We're really excited. We're hoping that groundbreaking will begin sometime this summer, but we're looking at a medical, dental, and mental health services in the community of Esparto. Also a large community center. So this is a beautiful 2-story, 28,000 square feet facility that's coming to Esparto. And we're just so incredibly thankful to receive the support from Yochidi, the Wintu Nation, and partner with our local community, because it's going to build a lot of partnerships. It's going to need a lot of partnerships to really provide as many resources as possible for our community. So that's the key issue that we're seeing is access to mental health services when needed, and the education and outreach to reduce stigma so that families are more willing to access those services. And again, I'm just thrilled that in the future, we're going to be able to have that in our community after so many decades of that need.
And I just wanted to highlight a couple of things based on my experience with Yolo before we go to Ms. Summers for that same question about needs. So first of all, Dr. Patel, in the 3-year mental health services plan, the issues that you talked about for the seriously mentally ill, case management, transportation access, these seem like really simple things, but they are what came up over and over again when they did public meetings with both people and their families who are living with mental illness. So I just wanted to reiterate how important that is. And Dr. Zadejas, the outreach piece, like I can't emphasize enough. Namayola County is your partner in that, also wanting to reach out to as many communities as possible. And you need to work with all of the other nonprofits, with the churches, with everyone in the community, because you have to go where the people are. You can't wait for them to come to you. And so I really wanted to just emphasize that point that you made too. So Ms. Summers, if you would please also share what you think the top mental health needs are in Yolo County right now.
I think one of the most important things that we are really seeing is with the adolescent population on our crisis line, suicide is actually the second leading cause of death between the ages of 10 and 24 years old. And right now in 2018, the national suicide rate among ages 10 to 24 increased over 57%. So what we did up until March 15th, when the pandemic was actually official, we had been providing for over 30 years a school-based education prevention program. And so we went to all the secondary schools in Yolo County, and we provided an SOS signs of suicide program. And in that program, it taught students not only to look for signs of suicide in others, as well as in themselves. We really have found in all the years of working with adolescents, they are much more reticent about reporting suicidal feelings, how they are feeling compared to helping out a friend. And so this was a way that we were able to really talk to students and do it in a face-to-face, school-based program. It would go in, we would have a presentation by a trained professional that would come in and really talk to the kids about how to look for signs of suicide, what the warning signs are, how to access help. We're able to provide them with crisis cards, et cetera. We have worked with the schools in the Davis Joint Unified School District, they did reach out to us, and we were able to provide crisis cards during this past year, but it's obviously not enough. We really, really have to get back into the schools. I think it's really critical. Right now, as you had mentioned before, the calls to the crisis line are really increasing. In January, we had 781 calls to the crisis line, and February, being a short month of 28 days, we had 735 calls. So we'll be reaching over 10,000 calls this year from people. And we were looking at it, and probably about 20% of our callers are people with what are considered a serious mental illness, and then either needed some sort of psychiatric service or some type of, program from that. Another thing that I think what we really have to do, and Sutter Health has really been wonderful in working with us. We work together on a follow-up program. So people that are calling, that are leaving Sutter, we work with Sutter Davis Hospital, that are leaving the hospital and sign up and say they would like to have some follow-up care from us. We then make follow-up calls to individuals and see how they are doing. Obviously we can't offer medical advice, but we try to navigate, what they might need or how they might access help, whether it would be through doctor's appointments or, to contact someone through medication issues. Right now we're following up with about 18 people. And some of the people, I think the longest one we've been following up with is 1 year. And the hope with this, and what I think have really seen from the results, is that it is keeping people from that kind of revolving door that, happens going through the emergency room. So I think one of the needs, because, obviously we're focused right now with Sutter, but I think that the Dignity Health System also needs to do something, throughout the rest of Yolo County. They are the only 5150 facility in the county. And I do think it's really an urgent need that we are really able to, provide some services, to this population.
Thank you, Ms. Summers. I'm going to start with you again on this next question, because you've seen such a significant increase in the number of calls as a result of the COVID-19 pandemic. And the next question is, how have the mental health needs changed as a result of the COVID-19 pandemic? So what kinds of change, are there any changes in the types of calls that you're receiving? Is it isolation? Is it stress? Is it fear of the disease? I mean, has there been changes in the type of mental health conditions or the type of?
Yes, it really, I'm sorry. There really has been. I mean, I think that when the pandemic began, everyone was sort of in a state of shock. And then I think feelings of isolation, and as we were getting conflicting messages in the beginning, I think that really provided a lot of uncertainty and anxiety to individuals. And so we were receiving many calls from people who were expressing, a lot of loneliness, that they couldn't go out, they couldn't see family members. People were very, very isolated. Anxiety, depression, situational problems. We saw a great increase in family relationships and problems there. We had kids who were having to do school homework. We have parents who have to work. We still have individuals that just weren't working from home, but had to leave. And then how are they navigating childcare? How are they navigating, getting to work themselves, getting the children to work? What are they going to do financially? And so problems that we have seen, in the past really were totally exaggerated and increased by the COVID-19 pandemic. And then when the wildfires hit last summer, and people then were unable to really go outside, and then they became even more kind of feeling trapped in their home. And so I think that really led to a large number of calls that we were receiving. Because on an average, in the past, we would have, probably about 4,500 calls in a year. So we're receiving anywhere 250, 300 calls. And to go up to 700, 800, 1 month we actually had 900 calls on the crisis line, is really showing, I think, what we are seeing, within our county and with the surrounding areas.
Thank you, Ms. Summers. Dr. Patel, how have mental health needs changed as a result of the COVID-19 pandemic from your perspective?
Sure. So I think just piggybacking off of what Diane said, I think obviously because of shelter in place, there was a shift to essentially move all the services from whether it was the provider being at home, or at least in our case at Sutter, the patient being at home. And so Sutter very quickly had to figure out, how did we sustain mental health care for our patients who wanted it, needed it, and more importantly, the increase that we saw. How did we meet the person where they're at was very top of mind for us. And so we had to figure out, for the protection of our patients as well as our providers, to move to a telehealth model, and what did it look like? Full transparency, we actually saw a surge of access to mental health services that we had not seen in the past, because we actually had offered telehealth services. So I think the thing that, at least we're recognizing, and I think across the nation, it's being very prevalently known that telehealth services, essentially is going to need to stick around. And so what is that going to do for the impact of, Yolo County and other counties? It is trying to figure out, well, for those individuals who don't necessarily have easy access to whether it's technology equipment or internet or things of that nature, our patient population or our county that serve individuals who live with severe and persistent mental illness, we may need to figure out ways to meet the person where they're at. And we may need to leverage telehealth, whether it's continuously now because we are still in a pandemic, or even in the future. So what is it going to mean on a more policy level to address this? Especially because obviously we know that some of the things that sometimes is a barrier for access is the fact that either the platform or the services are not available. So in this case, maybe telehealth is just not a model that's been implemented at the provider level, or else the person may not have access to the right equipment and technology to do it. And then the last piece is it's not a reimbursable service sometimes. And so I think there is going to be a need to drive conversations to really understand how to remove those barriers, both from the client patient perspective as well as the provider perspective and the health insurance perspective, to really make sure we continue to leverage telehealth. As we saw at Sutter, it made a huge difference with access. We definitely saw a lot more people, whether they were our youth or adolescents or even adults, or definitely our older adults. It was interesting, there were conversations, people thought, well, the older adult patient population is not going to use it, it's too advanced for them. And in fact, we saw a lot of people that are more, Medicare patient population that were accessing it, and they were getting better. So I definitely think this isn't just a temporary solution. Telehealth is here to stay. Digital care is here to stay. How do we make it available for everybody and not just those who can afford it or have access to it?
Do you see an increase? Did you see an increase in severity, or just an increase in number of people who had mental health conditions at Sutter as a result of COVID?
Yes. Yeah. So I think a combination of both. One of the other things we definitely did in 2020 is really take a closer look at our ERs or EDs. And, I know Diane mentioned Sutter Davis, and how is it that we were better at not only understanding if a person needs to stay on the 5150 hold, or if they could transition out, what did it mean to transition out? And, or if they needed to stay on the hold and continue to an inpatient care, what did that look like? How did we get it to be a more seamless process? So we definitely, through data, also saw that there was a huge increase in our access in the ERs. But I also think it's because we were starting to really look at it and unpack it and use data as a way to drive then strategic change we wanted to make. And in this case, it was recognizing that we were seeing an increase in the more severe symptomologies going through our EDs and going into our inpatient care settings, as well as an increase in individuals who are county beneficiaries, so county Medi-Cal recipients who are accessing our ERs to get care. And as I pointed out earlier, that patient population definitely will need a lot more support than just medication management to be successful in their recovery. And so I think it definitely just allowed us to see what more our patients will need as they move through the different levels of care that either Sutter or other organizations offer.
Thank you, Dr. Patel. Dr. Dejas, the same question for you, but I know we talked in one of our earlier conversations about how you've had some issues in the rural communities with telehealth, actually seen a decrease in the number of students who are accessing care. So maybe if as part of your answer to the question of how have needs changed as a result of the COVID-19 pandemic, if you could also let the audience know about what happened with your mental health services program as a result of the switch to telehealth.
Yeah, definitely. It's interesting, and it's common knowledge that every community is different, right? For sure. And the rural communities, it was even more different. And so what Rise did is we focused on the needs of our community. And so we were actually one of the few nonprofits that we kept our doors open the entire time. We completely changed the way we did things, right? We focused on safety of the community and safety of our staff first and foremost, but we kept our doors open for individuals that needed access to service. So from our food to our mental health and everywhere in between, the unemployment, signing up for Medi-Cal, I mean, our community needed that safe place to come and get that service in person. I'm very optimistic in hearing Dr. Patel's experience in the increasing of telehealth. I really want to focus on that because access is key, and being able to reach a broader audience. I'm really wanting to learn those strategies because we did continue to provide in-person mental health services in Esparto and Winters, and we focus on youth, right? That's our focus is K-12 students and families. And our focus is on mild to moderate mental health families and services. So our clinicians were continuing to provide services, and we offered it through telehealth. Our caseloads went from about 20, were cut in half to 10. And so we were outreaching to the school and asked the district superintendents to share our services with staff, and to be able to provide mental health services to teachers, to counselors, right, to the district staff. And we we did see an increase. We were providing telehealth, mental health services, but our clinicians were not maxed out, right? They didn't have full-time caseloads.
Mm-hmm.
So that was interesting, right? Because we were reaching a broader audience and providing telehealth, but our caseloads were not full. So I think there's an opportunity for us to do more outreach and education on that digital divide that I saw in the chat box. It definitely does exist, and I think it's amplified even more so in the rural community. And with our isolated seniors, our senior citizens population in the rural community, really have been impacted with the isolation. And we've kept our doors open to have that one-on-one connection with our community, to provide food and clothing and access to service and that human connection. But our services were severely impacted due to COVID. But at the same time, we were really proud to stand with our partners and provide in-person services. So since August 13th in Winters and Esparto, daily, Monday through Friday, 7 a.m. to 6 p.m., we were serving in person about 75 students every day in helping them with their distance learning, but providing that safe socialization. So we feel that could be a big part of why we didn't see the strong increase, because we were providing a safe environment for people to gather and to socialize. So we were having that daily contact with families, and we provided that service mainly for the essential workers who needed to work full time, right? Our agricultural workers who needed to go to work to be able to provide for their families and their children. And we have several examples of that where, a single mother who worked out in the fields was able to work because she knew that her children were safe with us and we were helping them with their distance learning. So it takes a community support, and I'm just thrilled that we're having this forum and seeing 65 champions on this
Right.
Zoom.
We need you. We need them all.
Absolutely. So thank you all, and yeah, this is important stuff.
Well, thank you so much. This next question, we're going to try and limit it to 2 minutes because we really want to make sure we leave time for the questions from the 65 champions, as you call them. So I'll start with you, Dr. Patel. This is, what are the most effective ways? So we're looking for like, what are the innovative things, whether it's your organization or another organization, what are the most effective ways the community is addressing the mental health needs right now, both for the seriously mentally ill and for people living with situational mental health conditions? Dr. Patel.
Right. So, I mean, I think I mentioned this earlier, but, I think regardless of who the individual is, whether it's somebody who's living with severe persistent mental illness or just more of a temporary or something that's happened uniquely in their life currently, I think we have the ability to continue to develop what are our best practices by using data. And by that, I mean, not just, of course, what their symptoms are or, what they're currently living with in terms of their condition or their illness, but other things that I think are important data points that we can continue to use to help drive change in terms of our mental health system. So I know that at Sutter, we've been very extensively, using both historical EHR, electronic health record data, concurrently with more current data that we're collecting from the patients when they're coming into our offices or coming into our hospital. We're using screeners a lot more, so mental health screeners, to really just understand what is happening in that person's life at this moment, and then how do we craft more treat to target treatment for these individuals versus just giving them more general. And I think that's very impactful for the success and the longitudinal impact of the mental health care that we're offering. It helps us to then better understand the needs of our community at a population health level. I know I saw this comment in the chat. Some of the things that we did at Sutter, because we had to leverage telehealth so quickly due to the pandemic, is we established teams within our IT system that were available for the patients to call or for providers to call should they need some help understanding how to even use the different platforms that we were using for telehealth. We figured out ways to, we have My Health Online, which is our patient portal that you can download on your phone or go through your computer. We leveraged that particular same platform as the way to have the face-to-face video chat with your provider versus adding a whole new layer of, another technology that maybe somebody didn't know. So we really try to take the patient user perspective, understandingly so that because there's sometimes, technology issues that may prevent somebody from being able to access that care. I think, though, there's still opportunities to grow in that. I know that, an idea I sort of threw around one time, I said, well, how come healthcare systems can't support even cell phone towers being put into place in local areas that are more rural so that they have the opportunity to then, increase access to the internet or cell phone, data plans? Or what are some strategic, innovative ways that community partners and healthcare systems and healthcare plans can get together to really figure out, because we can't necessarily always bring up brick and mortar locations. So what are other ways we can do it? I'll call out MHSA. Obviously, it has one of the 5 components is innovation, and the key word there is the term itself, innovation. How do we, really push those limits? And I know, I've been involved in MHSA since 2005, and I've seen it progress over time. And I definitely know we do have the private and public sector working together more, and as well as healthcare plans to figure out how do we just improve access. But I definitely think that conversation is nowhere near to be done, and I think it needs to continue to happen. So I'm excited to see such great representation on this call, because I think it just reminds us that, to my colleague's point, it takes a community, it takes a village to make things happen. And I think we need to have all different people from all different walks of life and organizations be involved in figuring out how to address the issues. The only last thing I want to mention that we did at Sutter too is we recognize that our frontline staff and even our administration staff that were either working the front lines or working at home were dealing with their own mental health care issues. So we did a lot of internal support where we also even leveraged technology to get access to mental health apps for our frontline staff. So our physicians, our nurses, even our IT department, they all had access to digital care so that they could help themselves during this pandemic as well. And we offered it for free to them. So we really tried to make sure that even just internal to our system, we were supporting those providers, because if they weren't at their best that day, then potentially they could impact the best for their patients. And we knew that they didn't want to be in that situation. So we figured out ways that we can support them along the way as well.
I wanted to just, for the audience, say the Mental Health Services Act, which Dr. Patel mentioned, brings $20 million a year for the next 3 years to Yolo County, and is being used for a variety of services. So all of you who are listening and our partners, there is money there for some of the ideas that we're going to come up with today. I just want to make sure that I emphasize that point, that is something that we can engage with the county about if there's ideas that people agree are important to move things forward. Dr. Patel, just one really quick follow-up question. You had mentioned in your first introduction and in this that you're learning about the patient, you're learning about what works for them and in order to provide them with mental health care. Could you give some examples of, you mentioned there's alternatives to therapy and to medication. Could you give some examples of what Sutter Health is recommending in some cases to patients, or what your approach is that is different from just the traditional therapy and medication?
Sure. I mean, I think one of the things that we're looking at, as I mentioned, is digital care. So we've recognized that sometimes individuals need support more at that moment or at their fingertips, knowing full well that this may not be accessible to all the patients or individuals we're talking about today. But what we recognize with some of our patients really are able and willing to sort of get that immediate support rather than having to wait for the therapy session, or rather than having to wait until their medication appointment. And so we have started and continue to partner with digital care applications that are coming out of Silicon Valley as well as across the nation. And how do we use those applications to give an additional sort of support for somebody in their ecosystem? So we all know there's many out there, but what we're trying to do is really identify ones that we think have a really good clinical backing to them, and introducing them to our patients as well.
Okay, great. Ms. Summers, I'm going to ask you the same question. So what are the most effective ways the community is addressing these needs right now? And you can also answer how your organization, alone or in partnership, is working to address these needs. I know you mentioned your school programs, so maybe you want to provide a little more detail on those, or if there's other programs that you're involved with that are helping to address some of these mental health needs in our community.
Well, one of the things that we are also doing is, as you mentioned, we are providing, support groups for anyone who has friend or family who has lost someone to suicide. What we've done with that, though, I think what Dr. Patel and what Rise is saying as well, is that this whole idea of participation and working together with partnerships. And so what right now that we're doing now is working with hospice as well as Sacramento in providing these survivor groups, because it's just not limited. People are living, throughout the immediate surrounding areas. And so I do think that that is really, very important. I also think that possibly looking at other types of support groups, something possibly through NAMI or through, with, again, working together in some sort of partnership where we can share our experiences as well as our, the knowledge that we have. One of the things that I always get concerned about is that, especially, because we, our main focus right now for the past year has been operating the crisis line. Since the school program, we're not doing any in-person classroom teaching right now, is that I think it is really important that we look at different ways to handle the problems, that people are experiencing. And when people call a crisis line, we consider ourselves not something, a referral agency. So we just don't want to be calling and referring out to, to other things. We want to try to help that person, what is happening today. But what I think happens is that when we do need to, give resources, et cetera. I think that somehow a county-wide shared mental health resource guide would really be important, because as it was mentioned before with family service agencies, we also use that, for people when they were calling in the past, and when that agency closed, things are shrinking, things are changing, and things are being eliminated. And so that's the worst thing that you can do when someone's having some sort of mental health crisis. You don't want to give them a number and then put them into some sort of, chasm of voicemail where they're going to go from one to another, and it's only going to exacerbate and heighten their anxiety. So I think if we could come together, and we have a resource guide, for mental health resources, and we would be happy to share that with other CBOs or other agencies or things that would be needed. So I think that would be something that could really be important to help people.
That's a wonderful idea. Same question to you, Dr. Zadejas. What are the most effective ways the community right now is addressing these needs, and how is your organization partnering to address the needs? And then we're going to quickly go into the most important part of this panel, which is talking about the opportunities, which we started to touch on, but we're really going to go into more depth about what the opportunities are to improve.
Yeah, definitely. I can be brief here. It's about the outreach and education. And so it's about relationships, right? Relationships and trust. And as you mentioned, Petrea, that in communities of color, they're less, and the statistics were alarming. I didn't realize it was so high, that they're so much less likely to access those services. So it's about the ongoing, consistent outreach and relationship building in those communities. We do a lot of outreach, but sometimes it's giving flyers and it's a one and done. And it takes a lot of consistent time to build that trust in specific areas and communities, and continue to provide that information that's current and updated, and then to establish that trust and relationship so that we can sometimes take those individuals to that service, right? That warm handoff. So that's what we continue to do, is to partner with organizations to stay current on what resources are available, and then that consistency, relationship building, and trust in the community, and particularly the communities of color that take longer to access those services, and we need to stay consistent and be and go where they are.
Which means a consistent source of funding. I'm just going to say, you need to be able to support that outreach effort. And we need volunteers to help with that outreach effort too. I'm going to have this next question for you too, Dr. Zadejas, because I think it follows up. I think we're heading into the opportunity area. And we talked about Mental Health Services Act funding that provides a significant source of revenue in California, which is unusual. There's many other sources of revenue as well. People are very generous with donations. So I think, honestly, if we can come up with the ideas on this panel, there are opportunities to implement what we talk about today. So for you, what opportunities exist for both your organization and for partner organizations to improve mental health services? I know we talked before this panel about parents needing, you have resources for students in the rural communities, but not necessarily for parents. Diane talked about, having a shared guide for resources. So we're all on the same page about if we have a support group or a helpline where we can refer people. So what sorts of opportunities would you recommend to this audience for, improving mental health services, both for people, and in your case, it's going to be with people who are living with situational mental health conditions.
Right. So in the rural community, where we can focus and increases with parents, adults, and the senior population. So I saw in the chat, I think Dr. Allen mentioned about the access to technology for seniors, and the training of seniors to access those and know how to navigate, and then having dedicated clinicians that specialize in providing mental health services for specific populations, right? So we hire our clinicians that have worked amazingly in the schools, right? They have a passion for working with K-12, and there's an elementary clinician that has that passion, a middle school, and a high school. And so finding and hiring the right staff that have that passion and commitment to serve specific areas and that expertise. And so I would expand on that. In the K-12 system, we're fortunate in Esparto that we are small, and so we can have dedicated clinician at each school site. And in the community of Winters, we have one dedicated clinician at the Rominger and Wagner site, but expanding that, right? In the larger districts, and I know it takes a lot more resources, but we can work and collaborate together to leverage funding. Having that access on site for families, for children, for families, it's key to be able to have them available. And there's that trust, there's that time, that relationship building. And so that's where we can expand, is focusing on those areas and enhancing and expanding those school-based services, because that's where a lot of families on a daily basis interact, is with the schools.
And do you think adults, parents also need more help? And I mean, one of the things that Yolo County does is also, in addition to providing we provide resources that people can access, like Diane does, but we also provide classes that teach people about mental illness so that they can learn themselves about mental illness and better able to help themselves or their family members. Do you think training like that is important in the rural areas too? Or?
Oh, absolutely. Absolutely. Yeah. The education of what is mental health, right? What is the severe mental health? What is mild, moderate? What are the different levels? I think that does take a lot of time and education for the community in general, and absolutely in the adults that need to know what is available and the education on how to navigate through that.
And it probably, as you said, those education classes need to be tailored to specific populations too. You need Spanish speaking for the Latinx community, and need to recognize all of the needs of those communities as well.
Yes,
okay, Ms. Summers, same question. I know you talked about support groups, and obviously I do think that having more support groups and coordinating across nonprofits about what support groups are offering and how we can help makes a lot of sense. You also mentioned, there was a comment in the chat too, where do we get, is there a list of resources that we can go to? To my knowledge, and you may know differently, we don't have a list of resources that we're all sharing as nonprofits and medical providers. And I think that would be a great thing to come out of this panel. Is there anything else that you think would be an opportunity to improve services from your experience?
Well, one of the things that I do think is important, as we talked about this mental health resource guide, is I think it is absolutely critical that is updated regularly. And that is always going to be something that will take, a lot of time, effort, and, as you talked about, possibly volunteers or something along those lines, because like I said, you just don't want to have a resource that you're giving to someone and then it's, the line is disconnected or the service is no longer available. I do like the idea of really support groups for people who are struggling, probably more with situational, conditions, as we had talked about. But I also think that they should be age specific. I think that there are different issues that we are going to see among, adolescents that we are going to see in middle age and our older populations. Mm-hmm. I think that they also have to be, in areas like we do our school program in Esparto and Winters and, the smaller communities surrounding us. And I do think that if we have groups, we also have to be able to offer them, have bilingual groups. I think that it's really important, because when people call the crisis line, when we look at the number of people who are calling and our Asian and our Black communities, type of thing, members, are really calling less than, Caucasian, let's say, things of that nature. So I think it's really important that we reach out to the different communities and try to figure out how can we help, specific things, because there are certain biases and certain cultural differences that we really have to address, among the different populations within the county. So I think all of those would be something, again, that we need to do. As I said before, I think it's really critical from our perspective with running the crisis line, and then also knowing that what we did with the school program, we did our last presentations on March 12th, and so we missed an entire spring session of adolescents that we would normally see. We could see up to 4,500 kids during a school year, and before the pandemic hit, we saw about 2,000. So well over 50% of the kids never even received, the program. We normally try to do seventh and ninth grade, 7th and 10th grade. It really depends upon the school, but we're trying to reach two different populations, in the secondary school and then in the high school.
So making sure that those programs are provided in the future even if we're in some sort of hybrid learning, is going to be important. Okay, Dr. Patel, I have a question for you. I wanted to ask you, so the NAMI Yolo County provides right now, our programs are tailored specifically for individuals and families living with serious and persistent mental illness. We do not provide, as Ms. Summers was saying, the support groups for individuals and families who are living with situational mental health conditions. So can you talk about, in answering this question about what opportunities exist to improve services, whether Sutter Health or other healthcare providers that you know of are providing these types of support groups for situational mental health conditions, and then any other ideas you have for improving mental health services?
Sure. So I do want to share a little bit of what Sutter decided to do to help access for our adults, families, and things of that nature that are looking for mental health care in the community. So Sutter, because it does have a limitation of brick and mortar outpatient locations, had to leverage technology, and we entered into a partnership with a healthcare technology company out of New York called Telehealth, which essentially is helping to remove the burden of responsibility and ownership off the patient to identify who's available in the community to give care to our patients. And it kind of touches upon a little bit of what Diane was saying, where sometimes the information is not up to date. So what Quartet does for us on behalf of our primary care physicians, we've now expanded out to pediatricians as well as our OBGYN service line throughout all of Sutter. In the Valley region, so that includes Yolo County. Your primary care physician, your pediatrician, your OBGYN, if they hear from either you or they themselves think it's important, they'll have a conversation with the patient about mental health and what it means to go get care and the variety of care available, and then submit a referral through our electronic record, which goes to Quartet. And Quartet has decided to provide sort of a range of services, starting with digital care. So you could opt to see, do your services just through like your cell phone, and just get those prompts during the day to help you out with your mental health that you might need to get those checks and adjustments done. And then you pair themselves up with a health coach that is trained to provide some simple, coping skills related to your mental health needs. So that's like the starting point all the way up to getting access to a psychiatrist in the community. And one of the things we did, especially because we know that Sutter is a not-for-profit and we do see Medi-Cal recipients in our primary care settings, we also developed relationships with each of the counties. So in this case, with Yolo County, we work specifically with the behavioral health director and her team to understand how would Quartet do that warm handoff if a patient, let's say, was a Medi-Cal recipient, needed mental health care and needed to get sent to the county for services because that's where they should go for care. How do we create a more seamless process for that individual rather than just, to the point that Diane made, like giving them a number, saying, here, have fun, and unfortunately, them not getting anywhere. We realized when our patients are in a mental health crisis or really willing and vocal about their mental health needs, we don't want to have them go through the burden of figuring out who's available and who's not. And so Quartet now has been in it's going into its fourth year, really has just given us the opportunity to more seamlessly, like I said, get access to our patients. The other thing that we did, at least prior to COVID, Sutter had partnered up with Yolo County Behavioral Health to establish a mental health urgent care center in Yolo County as a way to have a partnership both between Sutter Health mental health providers and the county providers to be able to just give a location somebody could go to if they needed more urgent mental health care. Obviously, we have physical urgent care centers, but we wanted to have that specialty of the mental health piece of it. And so it had nurse practitioners available to provide medication support, and of course, counselors and social workers to provide case management and therapeutic support. Unfortunately, as a result of COVID and obviously definitely the impact of shelter in place and financial reasons, The partnership had to sunset in 2020, but I think it was just a living example of the possibility of what we can do to also create that partnership and provide another formal brick and mortar location for somebody to go to that doesn't necessarily need to be at the level of an ED or an ER, but still a place they can go to get that support if they had a mental health crisis. So definitely, I think just an example for Yolo County to continue to consider, and of course, other counties over time.
Do the other healthcare providers have something similar to Quartet, or is that unique to Sutter?
So Sutter is the only California-based healthcare system as of today that has a partnership with Quartet.
Okay, so that might be something to explore with Dignity too, and other providers in Yolo County, as whether they can emulate that, as well as this brick and mortar clinic. One question that's coming up in the chat is the lack of beds in the Woodland Hospital for 5150 patients for the seriously mentally ill, and that sometimes people, if they can't get a bed, they need to go out of the county. Do you have any suggestions for how to improve that situation?
So I can only speak on behalf of Sutter at this point. And as I mentioned, in 2020, we took a really hard look at how our ERs were supporting the mental health needs of our patients, and specifically got to a place that we now essentially cross-pollinate our patients. So if somebody comes into our ER and they need to have that acute inpatient stay immediately, and let's say they are in Yolo County, and of course there aren't any beds available, we'll figure out how can we move them as quickly as possible to our freestanding hospital in Sacramento County, or if we can move them as quickly as possible to our inpatient units in the Bay Area. And then one of the other things we did is, because we knew discharge processes and getting the person back to their home base was also a challenge, we ended up saying, okay, how can we also leverage partnerships with Lyft, for example, or the county providers, or other transportation options to figure out, taking the burden again off the patient. How do we send them back home safely and not have to have them stress about that? Because we know the main priority was to get them into care, and we'll figure out how to get them home. And so one of the things we did is we actually did create master service agreements with Lyft to send our patients back home should they have had to cross county lines.
Okay, that's wonderful. Okay, well, I'm going to combine my last question. I want to remind everybody in the audience that I know there's a lot of experts out there yourself, so please put your questions that you have for our panel in the chat. I'm going to take these last questions and combine them into one, because I think they can, hopefully our panel can address them that way. So I'm going to start with you, Dr. Zadejas, and this is what communities, and this is youth, seniors, BIPOC communities in Yolo County are facing the greatest challenges with regard to mental health, and what patterns or trends are you seeing? And then as a part of that question, are there tailored approaches? You've already mentioned some of them, which is why I'm starting with you. So what are some of the tailored approaches that we can take as a community to address these needs?
Wow, in terms of mental health, I think all populations, right? Children, adults, seniors. I don't have any hard data to show that one needs more than the other. Just anecdotally, I know that people, right, like need relationships and are in need of access to services, and equity is a key thing. So I think I would focus there, right? Those that predominantly hadn't had access to various reasons, that equity piece I think is really important to focus on. To make sure that all populations have that access to services when they need it. So I think I would focus with that. My answer would be the most equitable way, the populations that really need it the most.
Thank you. Ms. Summers?
I totally agree with that. I think it's mental health access, which is critical, and it is for all ages. Unfortunately, we do not have a 5150 facility for children here in Yolo County, and so we have that problem if we have, which we have had for a number of children that have to be sent out of county, whether to Sacramento or to the Bay Area or something like that. I don't think that's something that's going to happen soon, But I think, again, trying to get mental health access for all populations is probably the #1 need in this county.
Dr. Patel, same question. Oops, you're on mute. Sorry. One of us had to do it.
I forget I'm on the phone and muted here, so my apologies. So I think the thing I'm going to focus on is youth as well. We recognized, especially during COVID, but obviously it's not existing just because of that, that social media has been such a huge influence on the mental health of our youth and our transitional age. Young adults. And so one of the things we saw with a lot of our adolescents and youth that were leaving our inpatient programs was they would return back to their homes and be sucked into that world again and not necessarily have access in that immediate moment to support them. So we actually worked, we have a Center of Design and Innovation, and in partnership with the mental health team, we developed a digital care application that's being given to our youth and transition age youth starting between the age of 13 to 23. And this application essentially is just a way to continue to build out the ecosystem for the youth, especially when they transition out of an inpatient stay. Our pediatricians are now offering it to our patients. And the nice thing I also like about it is we were cognizant of the fact that you can't just keep giving the treatment to the youth themselves or even the young adults. And I think somebody else on the panel mentioned this earlier. We also wanted to make sure there's a completely separate segment that focused for the caregiver themselves. So while the youth was on the application doing their own thing for adjusting their mental health needs, we also supplied information to the caregivers on how they can be available and open up that conversation with the adolescent or the youth, young adult, as it relates to their mental health. We did this because we realized, with COVID especially, although again, not just isolated with the pandemic, being stuck at home all day, you can sometimes just get sucked into that world of social media. And because they were already on their phones all the time, how did we then, sort of sneak in the mental health support as quickly as possible? And so, through AI as well as actual human touch, they get text messages just to check in with them and see how they're doing, and opportunities to learn things about their mental health, as well as just ways to communicate with others what their mental health needs are.
So I want to ask that same question for seniors. I have some personal experience, just the people that I know that really experienced some pretty significant isolation and deep depression as a result of COVID, trying to keep themselves safe, trying to keep their family members safe. Do you have any, recommendations for seniors coping with the, ongoing trauma associated with COVID-19, or have residual trauma, right? We've gone through a year of it. It's going to be tough. We're not going to get over it right away. Is there any suggestions that you have particularly targeted to seniors?
Well, I mean, obviously go ahead, Dan.
No, that's okay.
Dr. Patel, you go first, and then we'll go to Ms. Nimmers.
Well, I will be the first to say, especially having quote unquote senior parents and grandparents as well, that I even myself had my own stigma, thinking that my parents and my grandparents would not be willing and wanting to do simple things like FaceTime or just other ways to just digitally connect with the world. And I've been pleasantly surprised to see how much my, Asian Indian family, who, trust me when I say, some of them don't know how to use technology, have been wanting to do it. But I think for me, and I've said this before, having done other COVID-related presentations, mental health is something that I think every one of us is a part of. It's not just a mental health provider that is the driver and the force behind the communication and the conversations. I think mental health is an everyday conversation everybody should have with everyone, every time, no matter what. And so one of the things I encourage people to do is, if you notice that isolation is happening, or if you notice that somebody's not responding to your text messages, for example, try to pick up the phone, try to, do a FaceTime, try to see them in person with masks and social distancing. Go outside of your own normal comfort zone and engage in those meaningful interactions with somebody, because it can be significantly impactful. I know we live our lives very seamlessly in text message worlds or quick communication, but human touch is still there. And although we can't necessarily physically get each other hugs, there are ways to really just let somebody know that they mean a lot to you and that you're present in their life. And hopefully that we just remind ourselves to do that every so often.
Ms. Summers?
I agree. I mean, a lot of that is exactly what I was thinking as well. But I do think there are ways we can be much more creative. I think by, dropping flowers off at a doorstep. I think of leaving notes. I think, like you said, the social distancing. I think with FaceTime. I think with NAMI having a warm line, making outreach calls to people to be able to, talk to them. I mean, I think the texting and the social media for people that are involved in that, depending upon the age of the population that we are talking about. I think that, and then along with other things. I mean, I remember a number of years ago, when I was a seroptimist, and one of the things they did is they partnered up with Meals on Wheels. And I remember one day we spent many, many, many hours making placemats, and they had like greeting cards, and you would just sort of decorate, these placemats so that when people got their meal, they would have this placemat that would come along with it with, maybe some affirmation, maybe pictures of, smiley faces, cats and dogs, whatever it might be. But I think that there's just multiple ways, to be able to reach out to people, because that human connection is what really is missing. And that's what we're seeing on the phone call. The only other thing I just quickly wanted to add about, reaching adolescents and things like that with social media, they are spending so much time on it, but we are seeing a lot of big increase in bullying over social media. And that's one of my, real concerns about adolescents right now as well.
So I just wanted to further support that idea of these small acts of kindness and give a specific example. The group homes for adults living with serious mental illness in Davis that I was involved with helping to save with a group of citizens, their neighbors, they're in residential communities, and the neighbors during COVID were dropping off flowers, dropping off notes saying we miss seeing your faces and different color pens. That note was tacked up in their kitchen and people would stop and look at it. And these were 15 people living in one house, sharing rooms, right? Who could not leave because of COVID, right? They were quarantining at home because it was so risky for them to be doing anything outside. And so these little acts of kindness that the neighbors gave were incredibly important to them. So I just wanted to reiterate how that's also important. Dr. Zendejas, did you have also anything to add to that discussion?
Just the dedicated resources, right? So for Esparto, a specific example for Esparto, we have a halftime senior services coordinator.
Oh, wonderful.
And in a small community, a halftime is not even enough, right? Susan, she's such a champion, and she does home visits and does shopping and drops off things on doorsteps. And she's only at 20 hours a week. So I can imagine in communities of Davis, Woodland, West Sacramento, larger populations, they just the need for dedicated resources for the senior population.
Okay, that's really helpful. Okay, we got a couple minutes left here, but I'm going to wrap up. We have a couple questions in the chat that I wanted to get to. So first of all, from Geheda, we have, what are some actionable steps that college students, particularly those in Yolo County, can take to support mental health initiatives in our community? And I think this is a great question because we haven't discussed what college students can do. So who would like to start? I'll leave it open to whoever's got the best answer.
Repeat that one more time, can you, quickly?
Of course. What are some actionable steps that college students, particularly those in Yolo County, can take to support mental health initiatives in our community? So what can college students do to help?
The only thing that I can really address on that about is that we do work with the university as far as volunteer experience on the crisis line, type of thing. And I do think that I'm really amazed that probably we have 42 volunteers right now. We're starting another training, and we're going to be taking on 8 additional volunteers to help staff the crisis lines. And probably 55% of them right now are UCD students. They have to be third year, but I'm really amazed at the dedication and the involvement that once they get involved with the organization, how long they have actually stayed. And so we have a number of college students that stay anywhere from 2 to 5 years, even as they're going on to graduate programs and other things. So I'm very proud of the number of students that we have, that are offering their services and their time, and to really come into a very small space, this entire over, a year plus of during this pandemic, having to do the very, strict restrictions that we have in such a small space to have so many people at one time.
And I wanted to also say that Sheila Allen posted in the chat that the Yolo Healthy Aging Alliance has phone friends for seniors, connecting community volunteers to isolated seniors. So that's another thing that I think college students could engage in as well. We're reaching the end of our time here.
Yeah, it's funny. Yeah. That was a suggestion I was going to make, is we can just kill two birds with one stone and have the college students actually be the ones who are maybe going to the houses of the seniors and doing something in a social distance mechanism to give them some, friendly support and social interaction. So.
Yes, I really appreciate it. And then there was one question earlier in the chat that I wanted to make sure to get to, which was about the resources issue. And I just want to double check. I know, Dr. Patel, you responded to the chat, but we have a participant asking if there is a resources a list of resources that we could provide to people who may need them, especially as schools are opening up and there's lots of questions and additional stress on people. So Dr. Patel, did you want to briefly say what you wrote in the chat so everybody could hear it in response to that?
I think I had just mentioned that in LA, we had done a lot of mental health first aid, assist, and QPR, which is question, first aid, and respond, which is a suicide prevention training. And we did that in Spanish and English, and we offered it to probably every single public individual you could think of, starting from community colleges to probation officers to faith-based organizations to just the general public. And but we used it as a way to continuously educate that we're all in this together, and it's not just one group that's going to solve everything. We have to really work together.
Thank you so much. Well, I need to turn it back over to Jessica. I'm just going to take the next 30 seconds here to thank all of you so much, and to thank all the participants in today's conversation. I wanted to just emphasize a couple of things that came out of this conversation in terms of opportunities, things that we can follow up on. One of the things that we've heard in the rural communities, but actually everywhere, I think is what we're saying, is more outreach. We're using all the organizations that we have, work together on outreach. For more support groups. We have some support groups for people living with serious mental illness. We need more, it sounds like, for people who are living with situational mental health conditions. Crisis intervention training, Dr. Patel mentioned, is really important as well. We need dedicated clinicians. The ones in the schools in Esparto are working well. We need more beds for the seriously mentally ill at hospitals. We need more services for the seriously mentally ill, transportation, case management. Let's keep the conversation going. There's so many great things that came out of this. I really appreciate your time, and I will turn it back over to Jessica to end the conversation.
Thank you so much, Petrea. To our wonderful panel, thank you so much for sharing your tremendous expertise with us today. And to all of our participants, thank you for joining us and for being so engaged in this topic. Our next panel is next Thursday, March 18th, also from 11 to 12:30, and the topic will be housing insecurity. Then the following Thursday, March 25th, will be our final panel, which will be focused on where we as a community go from here. We have a wonderful set of panelists, as we did today, for both of those panels. So I hope that you'll join us. For more information and for the links to register, as well as the recordings of past panels, please go to yolocf.org, and the recording and summary of today's event will be up within 1 to 2 business days. Thank you so much for joining us.